Alright, hello everyone. My name is Riyad Ali and I'm a registered physiotherapist here at Progressive Health Services. And today we're going to speak about arthritis. Arthritis in itself means inflammation of a joint. Now there are many areas in which can be affected by arthritis, mainly in Trinidad's population and around the world. Your hip and knees and a little bit of the wrist are affected as well. Alright, so there are two common types of arthritis. There's rheumatoid arthritis and there's osteoarthritis. Rheumatoid arthritis is more of an immunocompromised disease itself, where the body's immune system attacks its own cells within the joint, causing inflammation within that joint. And osteoarthritis is basically degeneration of the cartilage within the bones, where it now exposes the bones to cause them to rub together to cause inflammation. So there are many risk factors that are involved in arthritis. Some may be your BMI, for example. If your BMI is above the normal range, which leads you now into the overweight category, that will indefinitely put extra pressure on your joints now, that extra weight, and hence cause that further degeneration of the joints. Alright, the next thing is your age. As you get older, the bones and joints degenerate over a period of time. So people who are 40 years and older, you have a higher risk and more susceptible to get this, alright, within your joints. The next thing is your occupation, what you do for a living. That usually affects it as well. For example, if you're on your feet constantly within your job, you are now exposed to putting your joints under a lot more pressure over a longer period of time, hence causing degeneration. And also your level of activity throughout the day. This can include your job as well and also exclude it. So after your job, what do you do? Do you do any form of exercises, or do you live a sedentary lifestyle? All these things affect, as well as your genetics. If you have the genetic predisposition to get arthritis, that is also a main thing. Some common symptoms for arthritis include pain within the joint, swelling as well, redness, and if the area is also warm. All of these are kind of indications to let you know, to guide you towards diagnosing arthritis. So to diagnose arthritis, there are many different diagnostic features that we do. There's the medical history that we take from you. There's also the physical examination of the joints to see what they are doing, how much stress they are under, and if the area is warm. We also do scans and any blood tests. For example, the x-rays, MRIs, any CTs, all of these things can help us to guide us to diagnose it, as well as the blood tests. Alright, this can determine your genetic sequencing and if you are more susceptible to this arthritis. So the treatment involved now. The treatment involved is where we take the medication. Right? There's medical involvement where you can take NSAIDs. There's non-steroidal anti-inflammatory drugs, and there's also steroidal drugs, which is the cortisone steroid shots. The cortisone shots, this is where it is administered directly to the joint, and it causes to decrease the inflammation within that joint. And hand in hand, that goes together with physiotherapy. Right? And physiotherapy now provides the means of strengthening the muscles around that joint. Because the joint is now under so much of pressure, we have to unload the pressure from that joint in the form of strengthening the muscles around the joint. Because the muscles is what holds up the joint itself to take off the pressure, to hence now relieve that pressure from that joint to ease up that rubbing of the bone-on-bone interaction. Right? So while the inflammation is decreasing, we strengthen up the muscles to help prevent that. And there's where your whole interaction of the medical perspective with the physiotherapy will hand in hand to get you painless and to get up in the morning without feeling stiffness, all these different things. All right, so please come and check us out for a consultation and we'll fix you right up.